you think about infrastructure, you have to say, okay, hang on a second, even in the GLP-1 phase, how did we not get that right when the GLP-1 craze really took over? And it turned out there were some true structural fractures in the system that were influenced by macro environments, tariffs, seasonal changes with hurricanes and forest fires, impacting non-discretionary ingredients that go into the very manufacturing of these medicines. This is only going to get worse. A simple example of that is subterranean pure water.
It brings up something that doesn't really get discussed enough. That is the underlying infrastructure, as you mentioned, like the infrastructure is the point. We often focus on algorithms and models, but less on the systems that actually enable them. So how do you think factors like you mentioned, manufacturing capacity, utilities, and system resilience shape the future of healthcare innovation?
It's a great question. Look, I think in summary, investors seem to be chasing algorithms at this point, and we're not safeguarding the infrastructure that we have. The reality is, unless the infrastructure gets upgraded in a number of different ways, from biomanufacturing to supply chain and logistics, to regulatory pathways that enabled effective reimbursement to reduce the cost of medicine for people in America, let alone the world, right? We are facing basic structural indemnities, if you will, that don't allow us to really fulfill that promise of making the system more affordable for patients at the end of the day, and making it safe and efficacious for patients to consume these drugs in whatever format they are delivered. And so when I think about what kinds of infrastructure are really needing desperate attention, one of them is the conversion, if you will, of electronic health data and claims data to truly be, let's call it, clinically actionable decision science-based entities, right? Today, electronic health records capture billing processes. They do not capture the livelihood of an individual in North America, particularly with unemployment being a big infrastructure issue across the board, or employment and people moving from job to job. You never get necessarily clean records. Now, of course, there are companies that are looking at this from a technology landscape, saying, maybe tokenization is a way of handling that to retain true chain of custody records for an individual's health. But that's all well and good until you hit the basic questions of what patients are really asking, which is, what have I got? Who should I go see based on what plan I have? And how much is it going to cost me? The reality is we don't support those questions today. We support those questions as individual units of cost based on workflows that, if they are AI driven, will be massively commoditized by year 3, year 4 of their existence. The reality is AI models are cheap. That is the truth. Incentive and incentive structures aligned to infrastructure is expensive. And this is where I think the big difference is going to come. We are massively underestimating the role of humans in this equation. At the end of the day, human beings, we only buy from people we trust. We may use online sources to inform us, but ultimately, it's no different going to one Toyota dealership to another Toyota dealership. Why do you buy from one versus the other? Ultimately, it comes down to experience and trust with the person selling to you. And underlying all of that, now we go back to healthcare. The 20th century healthcare, I gave you one example. The other example truly is in the elemental parts of it. Energy, purified water. If really 80% of all medicines in the future are going to be injectables. We saw, for example, Eli Lilly building a new plant, a new injectable plant in central Pennsylvania. It's a great initiative. Fantastic. There's almost $750 billion worth of new manufacturing investments coming into North America right now. But where are they going to get the water? Where are they going to get the energy to do all of that? Where are they going to get the basics to get those things done? Really, what we're seeing today is healthcare is competing for the most essential resources with AI infrastructure. That is a problem.